I'm Siri Diva Dion, and I'm doing this video today as a testimony to show and to prove that I am living in the goodness of God like many of us are doing, and of course to bring awareness to heart disease. So sit back, relax, enjoy. If you have questions or comments, please feel free to put them in the section below. In this video, I will not just take the information that I've received from the internet and from books and diagrams that are listed in different places, but I will also tell you about my personal experience with heart disease. Please note, this information should in no way be used to disregard your doctor's order or you're going to the doctor. Remember, different illnesses may come with similar symptoms and you don't want to be misdiagnosed. Now, remember, while both men and women can experience similar heart attack symptoms, women are more likely to experience symptoms such as fatigue, shortness of breath, nausea, vomiting, back pain, jaw pain, or abdominal pain, and these are referred to as unusual symptoms. Now, symptoms commonly shared with men are chest discomfort, shortness of breath, nausea or vomiting, dizziness or lightheadedness, sweating, and of course, extreme fatigue. This list is in no way exclusive or complete. Another thing to take note of is that symptoms may vary in some person. Changes in different people. Some people have a few symptoms. Some people may have all the symptoms. So if you experience any of these symptoms, especially if they're severe or persistent, you should seek immediate medical attention, and early treatment is crucial. So once again, those symptoms are back pain or jaw pain, abdominal pain, indigestion or heartburn, anxiety or sense of doom, rapid or irregular heartbeat, pain between the shoulder blades, pain in the upper arms or shoulders, coughing or wheezing. More symptoms do exist, but please check with your medical doctor and our cardiologist for complete information, as this information I just gathered from a little bit of research. Now I will go on to telling you about my personal experience. Stay tuned. It was April of 2021. At the time, I worked from home. I was having little symptoms of heartburns, pain, and cramps in my arms and my leg, but did not really think it was that serious. It was the week approaching Easter Sunday. I had to work on that Sunday, but unfortunately, due to the pains I was having in my shoulders, my back, my arms, I could not move. I couldn't even answer the phone. I had to call in off of work even though I had worked from home, so you know how that is. Now I decided I would go to the doctor, which happened to be the following Tuesday, which was the earliest appointment available. On the day I went to the doctor, I decided, you know what, this job may be stressful, so I'm just gonna quit. But on my way from the doctor, I said, let me go to the recording studio. I had a song that I had written for my mom for many years, and I figured this is time to do it since Mother's Day was also coming up, and it would be the perfect time to do this song. Went to the studio, wanted to surprise my mom to stop by the house, but she caught me before, so I said, okay mom, I'm gonna stop by on my way, and I felt so happy. I showed her the song. My mom was so happy to see me and told me. Here's a little bit of the song I did for her on that day.
Each time I see my mother, it makes me recognize strength she has inside, although she may not realize. Facts of life she taught me, how to stay alive, how to never give up when things may not go right. All of the times were so hard, she always made it seem so very easy. Always a hustle and a work hard, she
Yes, the song goes on, and Mom told me how beautiful I was. After dinner and all that at Mom, I decided to go home, and home I went. The events that occurred a couple days later knocked me off my feet. It's now Wednesday, and my husband left for work. I wasn't feeling well, but hey, I didn't think it was this serious. I was having heartburns, I was having cramps and numbness in my arms and my legs. However, I failed to tell you prior to that, when I would have these little pains in the center of my back and all that, I would say to my husband, hey, just knock my back. And that we did for a couple of days. Now, this Wednesday, I stayed home, I took it easy, but then my husband got home approximately sometime after 11, and yeah, I didn't feel well, so he was doing everything, cleaning up the kitchen, etc. Now, when we headed upstairs and we were getting ready for bed, as soon as I sat on the side of my bed, I had this real bad pain. I could not move. I started the sweating. It was so bad. I said to my husband, call 911. Call 911. So he did. 911 came, and of course, before they came, they asked the symptoms I was having, and yeah, I was sweating. All the symptoms of the heart attack were there. But when they came and they did my vitals and everything, they didn't see anything was wrong with me. So I said to them, listen, don't leave me here. Please take me. Yeah, I said, take me to the hospital. So they put me on the gurney. They placed me in the ambulance. When they tried to find a vein to put the IV, they could not find one. But they gave me some baby aspirins, and that kind of kept me until I went to the hospital. They took me to Homestead Hospital, which is under Baptist Health, South Florida. When we got there and they did the test, of course, this was during the time right there after the big COVID thing. They had to do a COVID test, and once they did the COVID and the blood work, they started whispering and saying, hey, if we have to do this procedure, we're not equipped, so we have to transfer her. Finally, they got another ambulance and they transferred me to the main campus, which was Baptist Hospital in Kendall. And from there, they did the test, the scan, and so on. Didn't say anything to me. Anyways, they sent me to bed. And the rest I will tell you in just a moment. Now, here's a little information about Baptist Hospital and the cardiovascular unit.
At Miami Cardiac and Vascular Institute, we pride ourselves on helping our patients. That's why since 1987, we've been researching and developing ways to improve cardiovascular care, focusing on the heart and blood vessels as one system. With that approach, our doctors have pioneered and researched less invasive ways to treat diseases and defects of the heart and blood vessels. Renowned reputation among doctors and the medical community means we're excelling in the advancement of medicine.
Okay, so here I am. I was kept at the hospital overnight, and around 4:30 a.m., I saw a lot of people just walking in, some taking blood, different doctors coming in to check on me, doctors coming in to do a sonogram of the heart and telling me, oh, how beautiful your heart looks. Then finally, one doctor came in. He's a cardiologist, and he says, Mrs. Harris, you have a procedure today at 1 p.m. You were never on the schedule, but we had to squeeze you in. I said, okay, no problem. And then it was on. They did what they had to do, and the beat goes on. Now, after the procedure, I was taken back to my room where I spent the night comfortably. Once again, the morning arrived, and the doctors started rolling in one by one. Now, the cardiologist comes in, and he said, Mrs. Harris, we caught it just in time. If you had one, it would have been massive. They're still not calling the name to be specific, but you know what? I got it. Yep, a stent had to be placed in my left artery, one of the main arteries, which was 90% blocked. I spent a total of 3 days in the hospital, then was sent on my merry way home. excited that I was sent home, had a song I needed to record. This is a song that I had written a few years ago. Could not find the beat for the song, but however, the day I got out of the hospital, I found the beat and I decided I am going to the studio the following Tuesday to record, and that I did. Here's a little bit of what I recorded.
Woke up this morning, open up my eyes, I give thanks to the Father for keeping me alive. I say, thank you, Jaja, I'm standing today. I give you praise, there's no other way.
And yes, there is more to the song, but I will let you hear it at some point in the future. Yes, I am living in the goodness of God. He has saved me before. Now He's gonna save me again. So keep listening. As we go further, you will know God is great. Okay, so now we forward to around September or October of 2023 when I started having chest pains once again, back pain so severe I had to leave work, go to the emergency room. Now they did another test, another scan, and this time it shows that there was a little mass growing somewhere in the left atrium. The deeper the information gets, just go to show that God is on my side and really means it when He says, if you make your bed in hell, I will be there with you. Let's go on. Once we found that the mass was in my left aorta, back and forth with tests, doctor's visit, etc., and struggling with the decision as to whether surgery or not, and remembering that when I went to the first surgeon, I looked at him and I said, no, God is not going to let you do this to me, because in the back of my mind, I was like, no, they're just going to use me for research. And then my cardiologist got so angry at me, he just said to me, you need to do this or you're going to die. He got so upset, and then he said to me, listen, I am going to send you for a second opinion, which he did. But before I go into the second opinion and where I did, I have to tell you that my friends and family, they were praying for me. My mom, my sisters, my husband, and the great support was there. And special mention, I have to mention Chris and Nadine Tucker, and of course the W Big Station Ministry, the members, the RTs, and the CEO of Hot Wax Blazing FM. Many others would take me a lot of time and take up too much of the space to enter them. But yes, a lot of people were praying for me. I was fasting and I was praying. Yes, and yes, God has kept me, and I'm here to tell you the story today. And of course, this one I do not wish for anyone, not even my enemy, to go through it, but God is able. He was there from the beginning. Yes, and special shout out again, I keep forgetting people, Reverend Hemmings, Ultra Reus Baptist Church, and the Exchange Baptist Church in Jamaica, and those members there who prayed for me as well. I just want to say thank you and thank God for having these people around me as my support system. Now, I have to note and I have to say this: no doctor ever wants to lose a patient. They really want to see you get better. And my cardiologist, I could see it, I could feel it. He turned pink when he realized that I was still iffy on making this decision, and he knew how dangerous it would have been for me. Thank you, Dr. Curtis Hamburg. I love you too.
My name is Dr. Curtis Hamburg. I'm a non-invasive cardiologist at Miami Cardiac and Vascular Institute. Practice of cardiology is totally different now than when I started. People were getting sick and we were trying to repair the problem. Now, prevention is obviously a huge part of cardiology. And with the newer techniques and the newer medicines we have, the practice has changed where I used to see one heart attack a week, and now with a busier practice, I'm seeing less than that a month. Quality of life's in the equation. I I think that you just can't treat the patient as a disease. You have to talk to them, see how they're feeling, see if they're satisfied with their life. One of my most important questions is, how you feel now? Are you satisfied? Because, a patient will tell you, I'm short of breath, or I have a little chest pain. But when it comes down to it, if you've treated them to the maximum of your ability, if they're satisfied, that's important. Regular follow-ups with physician, discussion with your physician. One of the big problems I've had over the years is patients sort of reading looking at the internet and following the advice of the internet. I always talk to my patients and tell them that we're partners, basically. That if they have a question, they should call. If there's something they want to discuss it with me.
All right, so here comes the time for my second opinion, and I was sent to Dr. Steve Zaitis at Mount Sinai Medical Center. I will be putting some information in here regarding Dr. Zaitis and Mount Sinai itself. Then I will come back and tell you about my experience as far as the surgery and everything else connected.
Nothing is more important than the health of your heart. When signs of heart disease or serious heart problems arise, you want experienced, expert cardiac surgeons who can pinpoint the right surgical procedures and treatments for your specific case. You want Mount Sinai Medical Center, the hospital with the most extensive cardiac surgery experience in South Florida, and the stellar team led by Dr. Steve Zaitis, Chief of the Columbia University Division of Cardiac and Thoracic Surgery at Mount Sinai, and co-director of the Mount Sinai Heart Institute.
Obviously, we're very proud of the fact that Mount Sinai performs more cardiac valve surgeries and more heart surgeries than any other South Florida hospital. When you get a sense of how deep our experience is, how prestigious our surgical team here is at Mount Sinai, there's no surprise that Mount Sinai has the best cardiac surgery survival rate of any Florida hospital.
A graduate of Harvard University and the Johns Hopkins School of Medicine, Dr. Zaitis brings a wealth of experience and expertise to Mount Sinai. He's board certified in cardiac and general surgery and is an expert in open, endovascular, and transcatheter approaches to a full spectrum of serious cardiac diseases, including valve disease, coronary disease, and aortic aneurysms. Dr. Zaitis is also an expert in minimally invasive approaches to cardiac and coronary diseases. Our cardiac and thoracic surgery team also specializes in endovascular and transcatheter valve replacement, angioplasty, defibrillators, catheterizations, and transaortic valve replacement, or TAVR.
Whenever possible, instead of cardiac surgery, we can conduct transcatheter aortic valve replacement, which isn't even really surgery. Unlike cardiac surgery, where there's an incision in the chest, transcatheter aortic valve replacement involves replacing the aortic valve through catheters through the groin without any incisions through the chest at all. It allows us to balloon the old valve and open up a valve on the stent, essentially a valve within the original valve. The recovery time is shorter, there's less pain, smaller scars, less infection risk, and other benefits.
Dr. Steve Zaitis, a renowned and groundbreaking surgeon leading South Florida's all-star team of heart care specialists.
All right, so the day came and I went for my second opinion. After speaking to Dr. Zaitis and his team, I decided, all right, I'm going to do the surgery. So we scheduled the pre-ops, etc., and the catheterization because they have to check out the veins and the arteries prior to the surgery. All right, did all of that. Now the doctor explained to me that it would be a small incision and showed me, of course, what they were going to do. And I went in to do my procedure on April 5th of 2024. And the day I went in, hoping that the next day I would go back to work and then I would have my surgery on April 12th. It didn't go as I expected. When I came out of the anesthesia, the doctor who did the catheterization said to me, "Ooh, you slept well. Let me tell you what happened." And he explained to me that the stent that was placed in my heart In 2021, my body was now rejecting that one, and the artery was still 90% blocked, and I have another artery which is now 80% blocked. So I said to him, "What do you suggest I do?" He said to me, "I suggest you don't go back to work until after this surgery." Now, I was not aware that they would have to reschedule the surgery based on their new findings. So, all right, went home. I was getting ready for surgery for the 12th, but went back to do some more pre-ops and learned that it's postponed for different reasons. Went back to see Dr. Zaitis, and he told me, "Miss Aries, you threw us a curveball, so now we're gonna have to really open you up," and you explained the procedure all over again, and we set the surgery date. And yes, it's coming up to that time. I will give you more information. At this time, I am still living on the goodness of God. Thank you, Lord. Thank you, because I know for a fact that I must have had several heart attacks during this time for what I was going through and the pain. It was even going through my head, some of the things that happened to me. I even said to myself, "Oh my God, I think they send me home just to die." But God was in control. He was on the case. So I'm telling somebody today, trust in God. Do good. Lean not to your own understanding. It says, "Seek and you shall find, knock and it shall be opened unto you. Ask and it shall be given." I begged and I pleaded with God several times, several days, and He saw me through. There is more to come. Don't go anywhere. This next clip is an actual demonstration of what a CABG is. And a CABG is the procedure I did, a double bypass and a resection.
A coronary artery bypass graft, or CABG, is performed to improve circulation to the heart muscle in people with severe coronary artery disease. In this procedure, a healthy artery or vein from another part of the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, carrying oxygen-rich blood to the heart muscle. One or more coronary arteries may be bypassed during a single operation. Before the surgery, an intravenous line will be started, and you may be given a medication to help you relax. CABG procedures are done under general anesthesia, which will put you to sleep for the duration of the operation. A breathing tube will be inserted through your mouth and into your throat to help you breathe. A catheter will be placed in your bladder to drain your urine. Coronary artery bypass surgery generally takes 3 to 6 hours. During a conventional bypass surgery, your surgeon begins by making an incision in the skin over your breastbone or sternum. He or she will then cut the sternum and move your rib cage in order to get to your heart. Throughout the procedure, your circulatory system will be connected to a cardiopulmonary bypass pump or heart-lung machine. This machine temporarily performs the functions of your heart and lungs during the surgery, allowing your heart to be stopped while the surgeon sews the grafts into place. One of 2 blood vessels is typically used for the grafts: the internal thoracic artery in the chest or the saphenous vein in the leg. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery just beyond the blockage. Your surgeon will then sew the graft into place. For the saphenous vein graft, your surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. With the graft securely in place, your surgeon will use electrical signals to restore the heartbeat and attach a temporary pacemaker to the heart. Once your heart is again beating normally, the heart-lung machine will be disconnected. Your surgeon will wire the breastbone back together and suture the skin incision closed. A temporary drainage tube will be placed through the skin beneath the incision.
And of course, as a reminder, I am putting little diagrams of the body and of the heart and with the symptoms. So as you go along, you can remember this is what we're talking about. Now, for what comes after all this visiting and the pre-ops, it's the day for surgery. All right, so we got up, my mom and I, my husband. Of course, I had moved in with my mom for the last several weeks. So now they're all there and my sisters, and we're ready to go, dressed up in my pajama and whatever they told me I could take to the hospital. And we got to the hospital approximately 15 minutes before they called me in for surgery. Reverend Hemmings of the Ocherius Baptist Church and the Exchange Baptist Church in St. Anne, Jamaica called me and he prayed with me. Approximately 5 minutes later, they called me in. My mom went with me. They prepped me. Then they said to my mom, okay, you guys can say your goodbyes. And she left. And that was all I knew until I woke up in the hospital room. And I will put a few videos, little clips in here of when I was in the hospital room. I was unrecognizable, and of course they gave me a beautiful view. I had a suite I couldn't even enjoy it, but to God be the glory. Yes, that was me. A lot of people did not recognize me when they saw this, but yes, God is great. I am living in the goodness of God. My sisters cried every day. My mother would come and she would pray. And thank God I got an excellent team, nurses and doctors. These other clips represent the view from my hospital window every day, and I was in so much pain it didn't really matter to me. So guys, enjoy your life, live as if it's the last day, but please remember to put God first. Put him first and everything else will fall into place after. And I can't emphasize again, lean not to your own understanding. And I want to thank the people again who prayed for me, those who sent their wishes even though they could not come, and the Tuckers, I can't say that enough, the W Big Station family, Brother Bunji, Andrew Turner, Sister Patricia, and all the members, yes, all the artists of Hot Wax, Blazing FM, Ken Solomon. The encouragement was just so great. I felt the love. I just felt God in everybody and around me. And my mother, she worked tirelessly and endlessly. My sisters, I have a sister who drove all the way from Fort Lauderdale. Could not give myself a bat. My sister Kane gave me a bat. My sister Jennifer gave me a shot. My sister Kathy also. I mean, everybody, the love was there. The love was just showering on me. So thank God. Thanks to the doctors, the nurses, the CNAs, just everybody. Live your life, but give God the glory every chance you get. Give him the praise. I am living in the goodness of God. Special thank you to my friend Ines Parks and her family. Played a really great role in my healing process as well, always keeping in touch. And of course, my friend lost her husband last year, November. So may Mr. Neville's soul rest in peace. We always save the best for last. This gentleman right here, Mr. Lennox Harris, my husband of 35 years, thank you for being there with me through all the ups and downs, through the thicks and the thin. It's really true. The strongest soldier gets the hardest fight.
Brother Brown, your console is empty? No, it's not empty, but
I was unable to drive or to do certain things for approximately 6 weeks, but God sent me angels, my mom, my sisters, my husband, and others. Thank you, Lord. I am living in your goodness.
Thank you. Thanks for all that you have done. There is